Hello World Wide Web, Dr. Ben again from Oklahoma Physical Therapy in Choctaw, coming to you by request today to talk as briefly as we can about sciatica, because I know this is Facebook and attention spans are short. So, there's many reasons I can give you sciatica. Don't have time to get into all that. What I am going to do is I'm going to show you 3 exercises for you to trial to see if you can help yourself feel better. Okay? Exercise number 1. Okay, exercise number 1 is all about trying to get you to get some relaxation in your lower back using a bridge. So here's what's important. Get a strap, put it across your knees. It could be a bathrobe, it could be a thick elastic band, just something. Knees, feet, hip width apart. And then the important part, most vital piece, even if you don't have a belt, is that when you bridge up, which a bridge is raising your rear off the table, that you're not using your lower back. So most people do bridges like this. We're asking you to think about taking your belly button to your belt buckle. Okay, so kind of curl up, squeeze your rear, keep pressure out on that strap. If you're having active sciatica or lower back pain, the first few might actually feel a little painful. Just kind of go through that, and then after you do some high reps, it should start to feel better. If it doesn't, don't keep doing it. Okay, I know that's hard to give specific advice on that, but we're trying to do this internet friendly. So anyway, so you go up and down, just like what I'm doing. Focus on squeezing your glutes, not squeezing your back. Should give you a little bit of decompression in your back and hopefully relax your back muscles. Do that, we usually do in the clinic for about 3 minutes, as long as it's not bothering our patients. All right, exercise number 2. Exercise number 2 is a simple stretch, particularly if you're having piriformis related sciatica. And it's piriformis stretch. I'm going to show you 2 ways to do it. 1, laying down. 2, because most people are spending their time seated, how to do it sitting up. Cross your leg over your other leg, making a figure 4. Gently reach down and pull the knee towards the opposite shoulder. Should feel a stretch in your rear. Okay. Similarly to the bridge, when you first pull, so first off, you're not trying to stretch your muscle and rip it in half. Mild stretch. If you're having piriformis sciatica, you might notice a mild little increase in your sciatica, but it should quickly start to fade as your piriformis muscle stretches out. The other way to do it is being sat up. The important piece to remember doing this way is you make the same figure 4. Just don't let yourself slouch and pull. So sit up nice and tall. Most of you Westerners will feel that whenever you just sit up tall, a stretch in your bottom. If you don't, gently reach down, pull towards the opposite shoulder, feel a mild stretch in your buttock. And again, if you feel a mild increase in your sciatica, give it a second. If it doesn't fade, don't continue to do this stretch. Exercise number 3. Exercise number 3 is pretty simple. Lay in what we would call the Sphinx position and see if your sciatica starts to diminish in your leg. Okay? The good news is this is easy. Okay? The bad news is that it usually means your sciatica is related to a lower back problem, like a disc bulge. You can repeat this or any of the other exercises that we mentioned as often as it gives you benefit, and you can use them in conjunction with each other. Don't use any exercise that makes your symptoms worse. So you might have to trial and error with a few of these. These all touch a little bit on some of the multiple reasons a person may have sciatica. If you don't get better, or if you need guidance, which is what I would recommend anyway, you need to go see a medical professional. We deal with this all the time. So now let me give you the shameless plug. So, what should one do whenever they can't get better? Just like in any medical profession, there are good doctors, there are good therapists, there are good chiropractors, there are good nurses, there are good everything. There are also bad ones. So let's talk about why, if you're not getting better, you should consider coming here to see us at Oklahoma Physical Therapy Choctaw. 1, the culture here is created from the culture that I wanted, which is I left a lucrative career in engineering to come to take a position where I help people in a direct way get better. We all feel that way here. That's a part of the culture. 2, board certified orthopedic specialists helping you. We're certified by the American Physical Therapy Association. We're board certified. Less than 6% of your physical therapists are going to have that credential. We're certified by the American Institute of Balance for vestibular problems.
Okay, certified for dry needling, certified for manipulations. We basically can do it all, and we can encompass it in one program unique to you, because here you only work with certified people, but you only work with licensed professionals. So come experience deliverance at Oakland Physical Therapy Choctaw. Like the video, like us on Facebook, leave your comments below, and we'll talk to you next time.